coronavirus infections are increasing daily in the country. Government is expecting 10,000 cases daily by the end of this week, and most of the new infections are concentrated here in Gauteng province. Have we learned how to cope with the expected influx of cases in hospitals? Well, let's discuss this now with private GP Dr. Daniel Israel. He's a general practitioner and member of the Gauteng General Practitioners Collaboration. Dr. Israel, good afternoon. Admissions, hospital pressures, that's always a worry when the numbers begin to spike. Overriding question first, how is the situation from your understanding currently? What are you seeing?
So, Dan, we've seen a big increase in the number of cases in the last few days. And one has to view this in the context of how it's been in the last, say, month or 2 months. In my own practice alone, perhaps we had 1 patient in a month up until about 7 to 10 days ago. And now we are seeing a good 20 a day of diagnosing them. And in light of what you just said, I mean, the numbers will just go up and up. But the good news is that we are seeing patients who are better clinically and more well than we have saw in the previous waves. And even though it's early still to say whether the data is going to show this and whether this pattern will continue, we certainly are encouraged by how patients are presenting.
Okay, I lost you a little bit there, Dr. Israel. Did you say how many are you seeing? You were seeing 1 a day in the last month or so. Currently, how many are you seeing in your practice?
We were seeing 1 a month, and that we are now seeing 20 a day. So that shows a huge increase. But the patients are far better clinically.
Okay, why would that be?
So we don't know. I mean, if you look at the Omicron variant, there is a lot of mutations, 50 in total and 30 on the spike protein. So without getting too technical there, the thought is that this variant looks like it will be worse. But one has to understand that until we actually see real live data on people, we don't know. And we're seeing at the moment that, look, largely a lot of our population our patients have been vaccinated, but we are seeing both in vaccinated and unvaccinated patients less severe disease. And the hope is that it will stay that way.
So even those who are coming to you, among those 20 a day in your private practice here in where you are in Johannesburg, even those who are not vaccinated are showing pretty much, if I can use the term, mild symptoms clinically?
So we're definitely seeing a difference between the vaccinated and the unvaccinated. And the people who we are watching closer and having to monitor their saturations of oxygen are definitely the unvaccinated, which is in line with the data that came out of Pretoria yesterday. About 80% of COVID patients in hospital are the unvaccinated. But the good news is, as a whole, the patients are doing better. And in my own practice at the moment, we have admitted no patients with COVID in the last week. We are managing many, and most have been vaccinated.
Okay, so most are vaccinated, you're managing them well. Even those who are unvaccinated clinically are managing well, because as you said, there's so much that we don't know around the Omicron variant that's got so many mutations. Could this therefore mean we should expect, hopefully, less pressure in terms of hospitalizations?
Good question. So time is going to tell. And the thoughts from epidemiologists is that the Omicron is already way on the up. And it's always a almost pressured race or pressure for existence between different variants. We saw that certainly Delta overtook the landscape, and now it looks like Omicron's overtaking it. If it remains mild disease, then it will be less pressure on the hospitals. But the most important thing, again, is that, you know, that we're looking at patients who are vaccinated largely in our circle. But in South Africa, we must remember that there's still a majority of people who are unvaccinated. And so it really begs the question, why not go and get vaccinated now? Now is certainly the time for people who haven't been vaccinated.
Okay, and the reports we saw even yesterday coming out of other hospitals, that we're also seeing a lot of children, younger children, and in this country the vaccination rate for the younger ones is not where it should be. But in your practice, have you seen children as well?
We see children every day with COVID. So in the first wave, there was no children with COVID, and now we are diagnosing children every day with COVID. Thankfully, most are doing well, but we have seen data overseas, certainly in the United States, which a lot of children were admitted in the Delta wave. And as you rightly say, it's a bit regrettable that we aren't that far in our vaccination campaign, that children between the ages of 5 and 11 can already be vaccinated, because in some countries in the world they are. And certainly we know that if they had been vaccinated, they'd be more protected, but definitely affecting children and likely to continue to.
Plus minus, the youngest age sort of in your practice, very quickly, Doctor, just to give our viewers a sense of how young are these children who are getting this Omicron COVID-19 variant?
Can you just repeat that? And I didn't hear the beginning of the question, if it broke up.
The youngest age that of the children that you are seeing. Oh, we lost that connection there. Just wanted to get a sense from Dr. Daniel Israel. Well, there you have it. He's been seeing an uptick, big one. From 1 a month, just a couple of months ago, he's now seeing 20 a day, people both vaccinated and unvaccinated with COVID, and they're seeing a lot of children as well. But thankfully, he says people are clinically better, managing this disease better than before. So the race to vaccinate is very, very important as well to assist in his view. Okay, we're